I'm gonna ask you about you. Who are you? Where you from? Would you start off with, I'm Naomi Cottoms, and you're from wherever, and a little bit about your bio, or just go through that.
Oh, she's not recording. I was going to set my thing.
Okay. You ready? Mm-hmm. Okay. We appreciate you giving us the opportunity to have this dialogue, and it will be just our dialogue. But tell us something about who you are and where you came from, and what road have you traveled in order to get from there to here?
Well, my name is Naomi Cottoms, and I was born and raised here in Helena, Arkansas. I am indeed a native, as we say. I graduated from Philander Smith College and had an opportunity to work there for many years. Returned home 11 years ago, and now I have the pleasure of serving as director for a small nonprofit called Tri-County Rural Health Network, whose mission is to improve access to health care. And what we do is work in the community, making sure that people have access to health resources.
Tell us something about, when you said this community, where do you...
Well, Helena has become one of the poorest communities in the nation. Helena meets the lowest or the highest ranking on the scale, pending the indicator, for poverty, for low educational attainment level, and any of those characteristics that go with poverty.
But it was not always like this.
It was not always like this. Once upon a time, as a matter of fact, my godfather, who is now deceased, described it as a bustling place. I knew it as a place where others came in to shop. I can remember when the streets were very busy on what they call Main Street, but the name of the street is Cherry. I came along during a time when there was a Walnut Street and a Cherry Street, and the Walnut Street was the black street and Cherry Street was the white street. And we had shops and restaurants, and even on Walnut Street we had what we call juke joints and hamburger places, and we had movie theaters, and today we have none of those things. We probably have 4 restaurants in the community, not including fast food restaurants, but in terms of sit-down places, we probably have about 4. That includes a couple of soul food restaurants.
With Cherry Street being, as you said, the white street, and Walnut Street being the black street, was life as separate as that?
Life was very separate back in the day. It was during the period of segregation, and so there were separate schools. There are separate schools now still, but there were separate schools. Everybody had their own everything. We did have access to the white community, but you know, it was a time when you had the colored only entries and colored only water fountains and colored only access to everything except what you had provided for yourself. And so it was certainly a period of segregation.
Now you, with Tri-County, you were serving everybody, and you were providing, I guess, a very much needed service to the community. What does that look like?
Well, before we get started, you know, we believe in something called community engagement. And so before we got started, we did some asset mapping, and we did some deliberative democracy forums in the community. Community members helped us to recognize that there are a lot of health resources that exist, but they weren't utilizing them. And the reasons they said they weren't utilizing them was because of they didn't trust, based on past experiences. A lot of things they simply didn't know about, they weren't aware of, and actually feared attempting to try to find out about those kinds of things. And then because we're a poor community, we have to prioritize food, clothing, and shelter. And so community members were not taking advantage of opportunities. And so we tried to figure out, including continuing to use community engagement, a good way that people could become aware of and could take advantage of what's available. And so we started something called the Community Connector Program. And these are lay citizens. We believe them to be non-traditional leaders. We run them through a very arduous training process. And they actually go out in the community and tell people what's available. and encourage them to take advantage of what's out there. And people have begun to do that.
It's successful.
Yeah, we were fortunate to have an evaluation done by UAMS College of Public Health, which showed that we actually saved Medicaid dollars. We narrowed our focus to just assisting people who were Medicaid eligible, elderly and adult disabled who were just Medicaid eligible, and to help them connect to home and community-based health resources. And those people have all been able to stay in their homes and not have to go to an institution. And we were able to show Medicaid savings of about $2.9 million and $2.92 on a dollar for each dollar invested.
Well, that is success. Well, so your connection with UAMS or College of Public Health, when did that start and how has that gone?
Well, actually, our connection started in the beginning stages. Our very first funding dollar came from a local organization called Mid-Delta Community Consortium. Miss Anna Huff Davis created a program called Arkansas Delta Rural Development Networks. And in her creation of this, we were one of the people that were funded. Her program is affiliated with, her organization is affiliated with UAMS, and her program is funded by HRSA. And so we received our very first dollars from them, and then we moved from that to not Robert Wood Johnson, but to Foundation for the Mid-South, who helped to fund the asset mapping and the community engagement piece. And then Robin Clark, who works with, who is the coordinator for the health unit, Phillips County Health Unit, introduced us to Dr. Catherine Stewart with College of Public Health at UAMS, who was looking for some creative rural health activity at that time, and we were trying to create an innovative rural health
initiative.
Okay, we'll say initiative. I'm looking for, you have diagnosis and then you have what's the word?
Intervention?
Intervention. Okay, yeah. I was looking for intervention. Thank you. So we were trying to create an intervention, and so we began to work together at that point, brainstorming, doing research, looking at what has happened throughout the nation. They even assisted us in bringing in consultants to share past experiences and best practices and things like that. And so our work began then. We became a partner with UAMS, College of Public Health, and they've just been beneficial to us in every way ever since. As a matter of fact, the connectors call Dr. Stewart our Earth Angel.
And so that relationship continues.
That relationship continues until today. Not only do they help us with the creation of proposals and projects, not only did they provide the evaluation, and I want to say something about evaluation because, you know, good programs come and go, services come and go. People help a lot of people, but if you can't demonstrate that through an evaluative process, sometimes you do not have a voice to show what you've done. And we were fortunate to have that through the College of Public Health. We could have done everything that we did, and if they had not done that evaluation, there is no way we would have been able to show the dollar savings and actually get the recognition that we've received so that we could continue to receive funding. So when we needed to move to sustainability, we were able to use what they had done to help us. That relationship continues today, even to advocating for our rights as a small nonprofit. But they are there as we move through every process.
What would you say you contributed to the College of Public Health?
Well, we bring our community knowledge. We bring our community experience. We are lay people. We know more about what we need than those from the outside. We know more about what we need than those who are not experiencing our woes right now.
So, have you? One of the things that College Public Health does is train students. For a student to be completely trained, we said they have to have classroom training, but also experiential training in the field. Have you made use of any of those students? And
We have.
what advice would you give new students that might be interested in coming in that direction?
We have, and let me tell you, it's been rewarding on both ends. We go at least twice a year to the classroom at UAMS and speak to students, sharing our experiences and practices in the community. But not only do we go and share, we've had the opportunity to have them come down and actually work with us. The last young man came at a really good time. When he arrived, we were providing community engagement process training for the presidential libraries. We actually had the privilege, Dr. Oates and I, of training 6 of the presidential libraries in the nation. And so we were doing that, and he came and he was able to sit in on one of the trainings. Loved the process. And then we had a community forum on some work with in Helena, and he came down and he actually assisted in leading the community forum. He loved it. He loved the work, and I believe professionally he was a nurse in the burn unit at the hospital in Little Rock. And since that time, he has now enrolled in school in the College of Public Health. And so he's looking at how he can serve people perhaps in a different light. So it was very good. It was beneficial for us and beneficial for the student. The advice that I would give is that while I believe that education is the essence of living, and that everyone should get as much knowledge as possible, I also recognize that all knowledge does not come from classroom and textbooks. And so, and I know that from a few head bumps. And so I encourage them to always have some hands-on experience, particularly with the types of people that they talk about in the textbook. You know, the textbooks are always going to talk about the downtrodden. And so I encourage them to actually go out and touch and feel some real people.
So you partner with a lot of folks.
We do.
Tell us, what is that? Has that process been helpful? Energy draining? Energy promoting?
Well, now you have to know that our work is hard work, and it is energy draining. Period. In that you gotta have wear a lot of hats. You gotta have like 4 hands, 12 feet, and you know. But it's very rewarding, and at the end of the day, even though you may be tired, you feel good about the work that you've done. Because of the partnerships, we've been able to provide opportunities for people. A really good example is when I mentioned Mid-Delta Community Consortium earlier. Our current program manager for was a young lady who came through AmeriCorps. Not only was she an AmeriCorps member, but then she became a community connector for Tri-County Rural Health Network after her tenure as an AmeriCorps member. And now she has moved into management as program manager for the program itself, bringing a lot of wisdom. I always remember how she's also a sister trainer. And I always remember how she brought things to the table that I did not bring, having actually done the work. When we move into job safety, for example, and I always talk about dress in terms of how you present yourself. And she does that as well. But she added also in terms of job safety, how dress could be provocative and could lead you to potential harm. And so she brings a lot of things that it's that hands-on, it's being real that oftentimes makes a difference.
And are there others you've collaborated with?
Oh, certainly. We partner with everybody in the community. We partner with the county judge and his office. We partner with our city government when it's operating. You know, in Helena, we do a lot of debating, so sometimes we're closed. We partner with the public school system when it's operating. We partner with other nonprofits like Boys, Girls, Adults Community Development Center in Marvel. We partner with all of the coalitions. We currently serve 15 counties, and so for those counties that have hometown health coalitions, we partner with them. For years we've had relationships with the health units for Lee, Monroe, Phillips, and St. Francis counties. We partner with our local fire department. We partner with East Arkansas Hospice. We partner with all of the health resource providers because we need to know what they provide, who they provide it to, the criteria for qualification, so that we can make sure that we're sharing information appropriately with the citizens.
So, can you imagine, you've been doing this Connect work for how many years?
We started in 2003, September of 2003.
That's 8 years.
Okay.
Can you imagine the area before this?
Can I imagine how things were? Well, you know, just based on what the citizens shared during those preliminary work days, people were simply just not utilizing. We have no data to verify, but we're sure that we've reduced some of the emergency room visits. We have no data to verify, but we're sure that people are better managing the chronic diseases that they live with, simply because they have access to things that they didn't have before. The evaluation that we did have was about Medicaid dollars, but those quality of life issues have improved as well. We just don't have statistics to present for that.
If a stranger came from another part of Arkansas, from another state, lived here for a month, liked what they saw, and wanted to replicate, what would be the first advice you would give?
Community engagement.
Community engagement.
Community engagement, and don't take what we have and just go away and try to use it as is, but you must adapt it to the needs of your community. There is no mold, nothing fits. There are just some examples, best practices, some core values that we have that we think people should also utilize. But beyond that, you got to go with what your community needs.
You know, the last minute piece of advice. No, I appreciate you doing that.
I think that for us, we're all lay citizens. We're committed to the work. We believe in what we do. And so we don't mind giving, whether it's in the grocery store, the drugstore, or during our official hours of 9 to 5. Not only are we committed, but we believe it has to be viable for the citizens. We don't do things just because. There has to be some benefit for the people that we're trying to serve. And so we believe that if people are willing to work in that vein, they'll be more productive. The people that work in this program, as I said earlier, are lay citizens. And I like to tell the story about Steve Harvey. Steve Harvey was doing one of his stand-up. He's a nationally known comedian, and so he was doing one of his stand-up shows, and the audience was just out of control. And so Steve Harvey was trying to bring him in line. I think he said he was in Detroit, and so they were just. And he said, "Look, don't make me come where you are." He said, because you know the real deal is I'm from here too. And he ended up saying, we is they, so don't make me act like you. So in the Community Connected program, we is they, we're the same as the people that we serve. And so what we do is beneficial because we're not better than, above, or less than the people that we serve. We is they.
Thank you.
That was great.
Yeah, okay.